be applied here that we use for addressing inequities in other places. So to close, some of the things we're pushing for now. So we're collaborating with the local ACLU to really push for data on disparities, for equity data. We don't have data on where the workplaces where people are getting this we don't have socioeconomic data, and we don't even have robust racial data. So policy is just happening in the dark, and there's no data to inform interventions that Professor Flores' research shows should be focusing on workplace, the enforcement of workplace safety nets, these sorts of things, and also the multi-generational character of households. We're pushing for clear mechanisms of accountability. Again, it's not only about private behavior, but it is about workplaces, which means holding large-scale farmers and large retailers accountable. That is not happening. It means addressing housing precarity. Low-wage workers are also higher risk of experiencing housing insecurity. So right now we're pushing at the city level to pass city-level housing sort of eviction moratoriums, like sort of the governor has allowed us. And finally, sort of, we're really pushing for the workplace dimension of this to make the rights and assistance that already do exist known and accessible, because even when they're out there, it's not enough to just sort of post them on social media or to sort of announce them. They need to be made accessible to people that are often Spanish speakers, may have connectivity issues with internet, and have discomfort with bureaucratic sort of language and things. So thank you for having us.
Luis, I have a question for you, because both you and Luis Olmedo talked to me about how the COVID pandemic has kind of re-energized local community organizations. So is this what's happened? Has this led to more activism from those very essential workers and essential people in the community that are more vulnerable?
So I think yes. One of the really powerful products of what we've done is a series of 600 testimonies from people that signed our petition. And these testimonies just spoke to very clearly that people understood what was happening. People understood the sorts of interests that this appeal represented to speed up reopening. And people understood how false these choices were. But I think people sort of didn't quite know what the outlets were for this kind of, for what was, a clear sort of problem of representation. So we do think that our organization emerged out of this. We know the Imperial Valley Community Health Coalition emerged out of this. And I do think that people are sort of the existential, or the sort of the life and death dimension of this really is bringing people into a political arena.
Okay, thank you very much. There are no questions right now, but we'll have another chance to go to questions. Next, we have with us Michelle Garcia, who is a nurse from Calexico Wellness Center, and she has been seeing patients. She has been consulting with patients, not just COVID, but in general. And she has something to tell us about the health vulnerabilities in the area. Michelle, thank you for being with us.
Thank you, Pilar. Thank you so much. Can you hear me okay?
Yes, we can hear you. Thank you.
Okay. So I'm a nurse practitioner, and I currently work at 2 different facilities. Right now, I do telemedicine with Calexico Wellness Center, and also in Laguna Hills separately. But what I see is that on a consistent basis is that I have patients who are lacking the education on how to improve their condition. Obviously, I think that there is a huge disparity with Hispanics and diabetes and all the other cardiovascular risks. However, they come to me and they truly do not know how to manage their diabetes. I have patients who don't monitor their blood glucose levels, are eating all the wrong things. They have to go to work, so they have families to support and things like that. They don't even come in to get their medications regularly checked and refilled and so forth. I have patients who tell me that they borrow their sisters, uncles, friends' medication. I took this because she had this. So there is a severe lack of education that's going on here. And this is a major component as to why COVID is so high.
Michelle, have you diagnosed anyone with COVID in your consultations? I know you do telemedicine, you do teleconsulting at this point.
Yes, I've had a few cases of positivity with COVID, yeah.
Mm-hmm. And go ahead, please go ahead.
No, sorry, go ahead, yeah.
No, I was going to say that people may not be educated about their own pre-existing conditions, let's call them that way, but do they have access to enough education? Do they have access to enough medical care, given that we know this is a medically underserved community?
No. Yes, they have access in the sense that we have a clinic there. However, there are so many patients that we have that just do not get the appointments that they need due to whatever reason. They're working and they can't do it. They don't know how to operate their phones and things like that. So when I see patients, I'm lucky if I get to see them via camera. Sometimes it's just via phone. And so there's so much more you can do with a face-to-face consultation versus on the phone. So yes, they have the ability to do so. However, lacking the proper knowledge on how important it is to take care of your health and things like that, I think that's what's missing. I think we need to spread that message and make that clear. Diabetes is a severe condition, and thus, it affects every organ in your body. I cannot begin to tell you how many patients I have who are they lack the education with nutrition, and going through their diets with them, it's like there's something missing. They do not see the connection, and that's where I am so happy to be able to provide them with that knowledge that I have, and in hopes that if I can change the life of one patient who can then change the life of their family or friend, that makes me happy.
Mm-hmm. Okay, we have a couple of questions for you. If you can answer, please do. Nestor, please ask your question.
Yes, hello, Michelle. Taking into account that you work in a hospital, I wanted to know if you're facing the same situation that we faced here in LA County. Yesterday, I went to a hospital, and I had to wait an incredible amount of time to be able to be tested. Do you have bottlenecks at this point?
Actually, I do not work in a hospital. I work in two separate clinics.
Okay.
So,
what do you know about the testing? Can you tell us anything about the testing? Are your patients able to get tested easily?
Yeah. Yes. So I believe Blanca and I are setting up separate dates where we can test patients just strictly on COVID. So I think we're trying to get together via either face-to-face and do it in Calexico, or at least on the phone. So yes, we're working on trying to improve that.
Yeah, and we can provide you, Nestor, with the contact information for the director of Imperial County Public Health Department, who's not on this call, unfortunately, but we have her contact, and she can talk to you about testing sites and all that. So thank you so much. Sunita, you had a question for Michelle?
Yes, I do. Michelle, how severe do you believe the undercount to be in your area?
So pretty severe, yeah. Patients, I don't know which speaker said this, but there are patients and persons who are afraid to be tested because of the fact that they'll have to stay home, and thus, how do you choose between I have to feed my family, my kids are not going to eat, or let me go out and make some money for wages for my family. So that's a huge thing right there. To answer yes.
Thank you so much, Michelle. We have to go briefly to our next speaker because he has to jump off the call at noon. So we may go back to the other speakers for questions. So Armando from the United Farm Workers. Armando, can you please share with us? And I know you've been working all throughout the states on the conditions of farm workers. And you told me that you have a lot of farm workers that are infected that you know. Please talk to us about what's going on in the fields and in the packing plants and all those places.
Thank you, Pilar, and thank you everybody for having me. And I apologize, I have a hard stop at 12. Yeah, we've been obviously dealing with this since the beginning, trying to engage the agricultural communities, but first by starting to send out letters asking the growers, contractors, and others to step up immediately. Unfortunately, those letters went unheeded because most growers continue to work and do operations as normal, and we're now seeing the effects of that throughout the entire country, California, obviously, and I can see that we have three major issues we're facing. One, wherever there is close contact, such as H2A workers having to carpool together, having to live together, there's a higher propensity of infection. Facilities that have a lot of surface space, such as packing houses, production facilities, etc., that workers can touch more often. We're seeing a lot more outbreaks there. As a matter of fact, we're dealing with one right now, not in Imperial County, but it's in Wasco, California, where one processing facility has 91 employees that are infected, 36 family members, 23 children, for a total of 150 coming out of one facility, and all because the employer wanted to keep things quiet because they wanted production. They did not want their production impacted, and so they literally did not communicate with their employees about what was happening to try to stem the spread. And similarly with guest workers, as they're carpooling, we're seeing operations in Salinas where 150 workers are housed together. It's starting to spread. King City is starting to spread. And the third part of it, which is also going to cause huge issues, is employers are refusing or failing to pay the employees for the CARES Act sick pay. As you all know or may know, California expanded it to include the food supply chain so that regardless of size of the employer, it would also apply. But we're hearing countless of workers left and right trying to figure out what to do because their employers refusing to pay them for either coming positive, having to quarantine themselves because their loved one is positive, or just outright terminating them, and that's how they're dealing with it. Not everybody. I also want to stress that not everybody does that. We also have some of our unionized employers are just going above and beyond, saying, hey, if you're 65 years old or older, we're going to pay you to stay home if you want to. If you have any symptoms, stay home. We'll take care of you. And being very proactive by also socially distancing, but and adding additional safety precautions. But I think it's spreading as now that the harvests are going on a lot more throughout California, throughout the nation. It's definitely spreading a lot faster. And with employers now basically continuing operations as usual, and even blaming the employees that that's their fault because they didn't take care of themselves. So we're definitely seeing a lot more of that. And with the undocumented status of most of the agricultural community, that's even harder. With guest workers being deathly afraid, not just for their health, but for their families'